Hello, everyone, and welcome to Munson Healthcare's COVID-19 press conference. Today is Tuesday, December 28th, 2021. This will be our last press conference of the 2021 year, which is amazing to think that we've been hosting these press conferences for over a year now. We're happy to bring you this information either weekly or bi-weekly, and to have a variety of speakers join us to share different information. Next slide, please. Normally, this would be a week when all of the different health department representatives join us. However, due to some scheduling conflicts, it'll be a short list of speakers today, but a lot of information to cover. So you'll be hearing from Dr. Christine Nefce, our Chief Medical Officer for Munson Healthcare, and Wendy Hershenberger, the Health Officer for the Grand Traverse County Health Department. As I mentioned, we do have a lot of information. We encourage you to ask your questions as you think of them. We will have a Q&A session after both Dr. Nefce and Wendy present their slides. You can submit your questions via the Zoom Q&A feature if you are a reporter and joining us through Zoom, or if you're joining us live on Facebook, please submit your question via Facebook, and we'll get to as many questions as possible after the speaker presentations. So first, it is my pleasure to welcome back Dr. Christine Nefce, Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefce.
Thank you, Diane. All right, so let's start off with the numbers. There's a mixed bag of news here. So we can go ahead and start with the, I guess, not great news. So that is that the percent positivity in the state of Michigan is going up to 18% today. And that's really over the last 2 weeks. But I think it's really important to note the 7-day average there that you can see at the very bottom is quite high at 26%. So, you know, the 14-day average is more leveled out and probably a better long-term picture, but we often look at that 1 week cumulative average there at that 26.3 to sort of indicate the direction we're going. So for the state, it looks like the cases are rising and are likely to go up fairly quickly. If we'll go to the next slide, there you can see our regional data, and we are holding steady. So we were at 15.6% the last week when we checked, 16.8 for the 1 week average. So we are holding steady there. I'm going to take that as good news at this point, but you can see that our cases do continue to rise, and certainly something as we prepare for Omicron, something to keep our eye on. Next slide. There you can see our inpatient numbers with our surges. So you can see we've come down nicely from that most recent surge. I do want to point out two things. One is that even at our low number here, we are really still sitting around the peak of what we saw in the previous two surges. The other thing that I want you to notice is how long this surge has been. So we've been talking a lot about how tired our healthcare workers are. You know, the strain on the healthcare system. And if you look and see how long we have been managing this most recent surge, it gives you a little bit of an indication there of why. Next slide. So these are numbers tracked through the CDC for the United States. So I think most of you have probably heard that the Omicron variant is here. Certainly we have it here in Michigan, but we're seeing much higher numbers across the country in certain pockets. So you can see there the trend there, a pretty sharp uptick. So we are again preparing for another surge as based on what we're seeing around the country. Next slide. We've talked a lot about vaccination here on this press conference. These are, again, our numbers for our region of completed. So we are currently at a 60.2% rate. There's some wide variation there. Our older population has a much higher rate of vaccination. Our children and younger people, much lower. It averages out to 60.2. But if you'll recall, we actually need quite a bit higher percentage rate of completed vaccination to reach that community immunity level. And certainly as we see a much more highly contagious strain coming our way, even more important. Next slide. And just again, as another reminder, our treatment options for COVID-19 are limited. So really prevention is the best way. So the best way to avoid getting COVID-19 is to vaccinate. And we know that while it's not 100%, as no vaccine is, you've seen our data, the ability to, with full vaccination, to avoid hospitalization and serious illness is definitely there. We do still have our infusion treatment with monoclonal antibody, but as a reminder, the monoclonal antibody really is not for hospitalized patients. It's for high-risk patients early on in their diagnosis of COVID-19 as a preventive measure and not to, to getting sicker. So not an option for people who are already sick and hospitalized. Next slide. Here's our current data. Again, these are patients who are hospitalized specifically for COVID-19. And you can see of our 85 hospitalized patients, 74 are unvaccinated, only 11 were fully vaccinated. And we're defining fully vaccinated right now as having 2 doses of an mRNA vaccine or one of the other vaccine. You can see there are 39 COVID positive patients in our ICU. Only 1 is vaccinated, and none of our 18 patients on a ventilator for COVID-19 are vaccinated. So again, I can't reiterate and stress enough how important and protective being vaccinated is. Next slide. A lot of news lately on the booster shots. With this more contagious variant coming, it is looking like a booster shot is definitely the way to protect yourself. So you can see here, mixing and matching is allowed. So if you have had one of the mRNA vaccines, you can really get any of the other vaccines if it's 6 months after your last dose. If you received Johnson & Johnson, at least 2 months after your last dose, you can again get any of the COVID-19 vaccines. So we do highly encourage everybody to get boosted. This will prevent not only you from potentially getting much more significant illness, but it will help us as a healthcare system keep fewer people getting sick and fewer people admitted to our hospital for COVID. Next slide. As another reminder, we are also starting to see influenza in our region. Thankfully, the numbers right now are relatively low, but we are starting to track a handful of outbreaks. And just another reminder, this is also a vaccine preventable illness. We are not clear what the impact of having both influenza and COVID, or having both of them circulating widely in our community, will have on our healthcare system, but I think most people would predict it would not be a good situation. So we are starting to see influenza. Please get vaccinated against influenza if you haven't already. Next slide. And again, as we start to see both of those infectious diseases spread, vaccination is key. Boosted for COVID-19 is also very important. And you will recall we are under a public health advisory for wearing a mask indoors. This is the same message we've been saying all along. There are good mitigation methods to preventing the spread of COVID-19 as well as influenza. So wear a mask in an indoor setting. Try to gather, if you need to, in a well-ventilated space. Outside even is probably the best. Please continue to practice social distancing. Wash your hands frequently, avoid touching your face, and really start asking friends and family about their COVID-19 status so that you can take the right precautions for you and your family. And just as a reminder, since we are still in the holidays and many people are traveling, please do not travel if you are feeling sick. And the CDC's recommendation is also to not travel if you are not vaccinated, as that puts you at much higher risk. Next slide. So I want to talk a little bit about the Omicron variant. You'll recall we had Dr. Ledke on last week who went into depth about this variant. So we're just going to quickly summarize here. Omicron is a variant of concern. What we know is it's much, much more contagious than the Delta variant, which was much more contagious than the original strains we saw of COVID or of the coronavirus. There is some news from other countries that show that the Omicron variant could be less virulent. It is early and preliminary data, so we're not positive of that. We are hopeful that that is the case. I do want to stress, though, that when we say less virulent, we are talking about hospitalizations and deaths. So there still is, with a much more contagious variant, the risk of putting a lot of additional strain on our healthcare system. So it's really important that we continue to work together as a community to temper that surge. Flatten the curve was a term that we had used before, but we are really counting on everybody in the community to help us so that we can continue to function successfully as a healthcare system and take care of all the people that come to us in their time of need. Next slide. One of the things that you'll be hearing is about masking. So part of what makes the Omicron variant more contagious is that we think it's not spread by droplet, but it's actually more aerosolized and airborne. So masks have an even more important role to play here. So if you do mask, which again, we really highly suggest and ask that you do, having 2 or more layers of breathable fabric are important. Making sure that your nose and mouth are completely covered and that that mask fits snugly against your face. So there's no gaps on the side or underneath. A nose wire can help with that. It also can help prevent fogging up your glasses if you're like me, where you wear glasses. Fabric that makes it hard to breathe or is super sheer are not going to really help you very much. A valve on your mask is not helpful either, as it allows virus particles to escape. And then, you can buy KN95s and N95s. We are asking, again, as we continue to deal with supply chain issues, that N95 respirators really are held specifically for healthcare personnel and other high-risk people, although KN95s do appear at this point to be readily available out in the community. Next slide. Gaiters and face shields, the face shields are helpful in addition to a mask, as it prevents, droplets and can protect your eyes. The gaiters are less effective, but if you do choose to wear one, again, making sure you have multiple layers of that gaiter are expensive, or are important rather. Children, it's important that they mask as well. We don't put masks on infants or younger children. But again, it's as important that you get a smaller mask for them so that it fits snugly against their face. And if you're out in the cold, one of the benefits maybe of being in Michigan versus Florida is that mask can actually help keep you a little bit warmer. So totally okay to put your mask on and have your scarf or ski mask or whatever you choose to wear to keep you warm over that mask. And again, as a reminder, there is a public health advisory from the state of Michigan, Department of Health and Human Services, stating that everyone should be masking indoors. Slide. All right, I think that was it for me, Diane. I will pass it back to you.
Thanks, Dr. Nefce. We'll have you back in a moment for the Q&A session.
Thank you.
Next, I'd like to welcome back Wendy Hershenberger from the Grand Traverse County Health Department. And welcome, Wendy. Excited to hear your update.
Thank you. Good morning. So I'm going to jump in today with the newest guidance from Center for Disease Control. Late yesterday, they updated and shortened the isolation and quarantine periods for COVID-19. So I'm just going to go through some of that based on the information we have at this time. So just a reminder that isolation is for those who are ill or infected with the virus, so you test positive. I often hear people asking, what's the difference between isolation and quarantine? Easiest way to remember it is isolation, ill, and infected all start with I. So that's the way I learned it in graduate school. It's the easy way to remember it. So CDC is shortening the recommended time for isolation from 10 days for people who have COVID-19 to 5 days, followed by 5 days of wearing a mask when they're around others. And this is, of course, if you either have no symptoms or your symptoms are resolving after that initial 5 days. This change is based upon epidemiologic science that demonstrates the majority of the SARS-CoV-2 transmission or COVID-19 occurs early on in the course of the illness. So generally in the 1 or 2 days prior to the onset of symptoms is when you're infectious, and then the 2 to 3 days after you have a positive test or symptoms. So that 5-day period is showing through monitoring of epidemiologic information that that's the 5 days that you're most infectious. So anybody who tests positive needs to isolate for those 5 days. And then again, if they're asymptomatic at that time, they can leave isolation, but they should continue to wear a mask for 5 days after that to minimize the risk of infecting others. So remember, this is an infectious disease, and it's all about reducing risk to spread the infection across our community. These recommendations are really meant to balance what we currently know about the spread of the Omicron variant and the protection that's provided by the vaccination and booster doses. So next we'll move on to quarantine. So quarantine is for anybody who is exposed to someone who had COVID-19. So the recommendations here are if that you have received a booster shot, so you've received your initial first 2 of the mRNA series or the initial Johnson & Johnson and subsequently received a booster, you do not need to quarantine, but you should wear a mask for those 10 days after that exposure. And then for anybody exposed, it's always best practice that you should get tested around day 5 after that exposure, just to make sure you don't become ill or infected. If you do have symptoms, you definitely need to quarantine until you get a negative test that comes back that says that you don't have COVID. For those who are unvaccinated, or if it's been longer than 6 months from your Pfizer or Moderna series, or 2 months after you received the J&J vaccine and you haven't been boosted, they now recommend that you quarantine for 5 days, followed by strict mask use for those additional 5 days. Again, this is all to reduce the chances that you're going to spread it to others if you do become symptomatic. So there is an option in there. It says if a 5-day quarantine isn't feasible, it's imperative that you wear a well-fitting mask at all times for those 10 days. And that particular guidance is really meant for healthcare workers who have that, exemption to work, or in the households, if people can't isolate from others in the household, can't separate, you just keep wearing the mask, or perhaps in a congregate care setting as well. All right, next slide, please. So moving off of the CDC recommendations and looking at Grand Traverse County numbers and trends, our county remains at high transmission rates right now. Our weekly case rates have been decreasing for the last few weeks. We are currently at, we've had 264 newly identified cases in the last week and 4 deaths. So those numbers compared to what I reported out the previous 2 press conferences are lower. We're averaging 38 cases per day. Again, that's slightly lower. And our current Traverse City regional percent positivity is 14, and Grand Traverse County is at 14.1. So we're pretty consistent with our region right now. And then the trends statewide are, again, decreasing cases and deaths for the past 2 to 3 weeks, but we do anticipate that we will start to see an increasing either due to holiday gatherings or once we start to see the spread of Omicron. We are not aware of any Omicron. It has not been identified in our county yet, but it can take 10 to 14 days for that to be sequenced. So it very well could be here, and we just won't know it until we start to see the increase in numbers. And then just a reminder that we hear about breakthrough cases, and about 2% of the people who are fully vaccinated have reported a breakthrough case. So although I think people start hearing numbers, when you look at that 2% rate, it is relatively low of all the people who are fully vaccinated. Next slide, please. So this slide just shows the distribution of cases in our county by month. I just thought I would show this because we've talked about how the latest surge this fall and early winter is worse than last April. So you can see the histogram numbers right here, and you can see that, you know, truly we have seen significantly more and like a slower build of cases, and we're still starting to work our way back down, but likely that'll start to go back up once we see Omicron in the area. And then again, the next chart shows our number of deaths, and you can see that this last surge has definitely resulted in quite a few more deaths. Interesting to note that our cases are fairly evenly distributed between male and female. So males make up 46% of the cases and female 54%. But of our 125 deaths this year, 66% of those were in males. So not sure on the reason, but just an interesting statistic. And also just a reminder that you tend to see a lag in the death as an indicator. It usually happens, say, 2 to 4 weeks after the onset of illness, but could occur later as well. All right, so next slide. Dr. Nefce talked about vaccination through our region. So this slide just shows the vaccination for Grand Traverse County, broken out by age group. You can see what she talked about there, that when you look at the 65, 75 plus, we're very highly vaccinated with, you know, 90% plus in those age groups. But as you get down to some of the younger age groups, those numbers are kind of below that 80% threshold. We are still, you know, slowly vaccinating that 5 to 11-year-old population. And also just wanted to show some numbers. Although we overall as a county are at 73.4% for initial first doses and 67.5 are completed. The actual number of doses given in our county, you can see the first doses are over 64,800. Second doses are almost 60,000. And then those who have been boosted are that 27,428 number. It's hard to calculate a percentage for who's been boosted because it's a rolling timeline of who's eligible, because it has to be 6 months since your previous. So I'm hopeful that the state will be able to start generating that indicator for us as well. Next slide, please. This is just information for our vaccination clinics. For the 5 to 11-year-olds, we're vaccinating this week, primarily second doses, which were already scheduled. Next week, we do have availability of first and second doses. The second doses, again, are already scheduled. So you can see our schedule there. You can also pull it up on our website. And then Wednesdays at 5 o'clock are when we roll out the vaccine schedules for the 5 to 11-year-olds and also our Cherryland clinic. Next, and just a reminder that the 5 to 11-year-old vaccinations are at the main health department building, which is on the Franier. Next slide, please. And then for our Cherryland vaccination clinic, that's at the Cherryland Mall. Again, our appointments will be released Wednesdays at 10 a.m. And so for this week, we're vaccinating today, tomorrow, and Sunday. And then next week, Tuesday, Wednesday, Thursday, and Sunday as well. And we offer all versions of the vaccine. Again, appointment only, and we still have quite a high demand. So we do encourage you to make that appointment. And if you have to cancel, we encourage you to go and cancel to free up that space for someone else. We're not doing any testing at this time, but we are working on with some state partners to try and get some testing events in the next few weeks as well, just trying to increase the testing availability in the region. Next slide, please. So we do know that there are a lot of people who are doing home tests. If you do get a positive test, we do ask that you submit your information here. So we can provide you some information, including, you know, how to seek treatment if necessary. And then the last slide is really focused on influenza. Dr. Nefce talked about that too. So we are still offering influenza vaccines at the health department. And also just wanted to show some numbers about our coverage so far. We're at 43.9% for Grand Traverse County. The state of Michigan's just over 26%. So We are doing a little bit better on coverage than the rest of the state, but overall, we're significantly behind where we were a year ago with vaccinations for influenza. That's all I have today. Thank you.
Thanks, Wendy. And now I'm going to ask Dr. Nefce to rejoin us, and we will begin our Q&A session. As a reminder, either submit your questions directly through the Zoom Q&A feature or through Facebook. And we do have quite a few questions that have come in already. And I'll begin with something that Wendy just mentioned, which was a pretty good segue into the home testing kits. We have two individuals who are asking about the availability of home testing kits. So one person says home testing kits made it possible for us to gather as a very small COVID negative family. Rapid test kits are now very hard to find. Is there any good news on the home testing front? And another person said, when will home test kits get to the homes? They are not available in stores or online. Dr. Nefce and Wendy, any idea of any supply chain issues there? What I suspect might be happening is that the CDC had recommended that people test family members and people gathering at their homes, so that may have had them flying off the shelves, perhaps.
Yeah, I can go ahead and start, and Wendy, please fill in what I miss. You know, we have had some supply chain issues ongoing throughout this pandemic for many different things, and I think most people are aware that our initial testing response was fairly poor, and we continue to struggle with the availability of tests on a consistent basis. That being said, I know the state is working with the CDC and the federal government and FEMA and a bunch of others to make testing more widely available. I know there's already a test to stay school program where schools can coordinate with the state to get tests available for students to do that testing to allow them to stay in school. And while we have plenty of tests at a hospital level to test our patients and employees and that kind of thing, we are hearing from the general public that they can be hard to get a hold of. So I know that at both the state and federal level, that is something that they are looking at and trying to get access to more over-the-counter antigen tests. The state has been off for the holidays, so I haven't had an update from them in the last week or so, but we will continue to ask and get more information and get that out to you as we get it.
Thanks, Dr. Nefce. Wendy, any comments on home testing?
No, other than I agree, it is hard to find. I know myself, I was trying to find some, similar for our family gathering. And I do know that the state and the feds are going to come out with more. I think we do not have individual home test kits available. I think people thought we were, but we do not have any from the state at this point. As soon as we do, we will definitely start to distribute them. And again, like I said, part of our challenge right now is just being short-staffed and having multiple priorities. And we know vaccination really is really the thing that's going to reduce your risk of severe illness or death or being hospitalized. So the limited staff that we do have are really focused on that, but we are working to try and bring some state testing partners to the region. I know some of our neighboring health departments have some testing going on this week, as well as next week. And so there is testing in the region. It might not be right here for some of those drive-through sites. And again, I think the pharmacies are still doing testing as well.
Thanks, Wendy. And I will make a note to keep this as a topic of conversation in future press conferences as well. And as we get more updates or learn new information, we'll be able to share that with the public. So moving on, Dr. Nefce, this next question is for you. Compared to other risk factors, how much of an impact does obesity have on someone's chances of surviving a COVID diagnosis, particularly Omicron?
Well, I don't have that data specific to Omicron. What I can say is that we know obesity is a significant risk factor for having more serious illness with this particular coronavirus. You know, it is definitely a risk factor and something that we have seen certainly cause some more significant clinical issues for our inpatients.
Thanks, Dr. Nefce. Another question for you related to treatments, and I'll ask you first about some of the new pills that may be coming onto the market, and then secondly about monoclonal antibody. But the first question is, how effective will the newly authorized antiviral pills be in treating COVID-19? And are these pills a game changer?
Well, I think that remains to be seen. And I want to be clear on two things. One is that those pills and the monoclonal antibodies are not for inpatients. So these are strictly held for people with more mild disease that are in an outpatient setting. So, you know, the Merck one is probably a little bit more limited than the Pfizer one. For instance, you can't give it to children, you can't give it to pregnant women. You have to be for 3 months on a birth control if you take that pill. So that one will be quite limited. And the Pfizer one, you know, there have been sort of mixed reviews about how helpful they are in preventing illness. And part of that is probably because, again, it's for people who are outpatient only, not sick enough to be in the hospital. And, you know, the diagnosis has to be made fairly early on, not dissimilar to what we're seeing with the monoclonal antibody, where, you know, we can prioritize those patients that are the sickest. But once you're in the hospital, you know, our treatment options remain limited for once you've been hospitalized. There are two issues specific to the Omicron virus or the Omicron strain. We continue to see supply chain issues, as we've said. You know, that impacts a lot of different things, but the availability of the monoclonal antibody just in general is limited. You know, we have to order it on a week-to-week basis. Sometimes we get what we ask for, sometimes we don't, but that we're seeing limitation across the country, and especially as we see surges in other parts of the country, the demand there goes up. The other issue is that the current monoclonal antibody that we are using is not effective against Omicron. And so there is a new monoclonal antibody that we are asking for as we see the transition to Omicron being the more predominant variant. But, you know, as an example, the news we got today was that there were only 300,000 doses for the entire country of that new monoclonal antibody. So again, supply chain issues are big. We are going to be further prioritizing who can get those monoclonal antibody treatments. But again, the pill and the monoclonal antibody are reserved for those people who are not sick enough to be in the hospital.
Thanks, Dr. Nefce. And I think that's a good segue into one of the questions I'm trying to find here was related to inpatient care. So this is a question I think we hear quite often is, what are doctors giving to patients who get, who get hospitalized COVID medication wise? Why does it seem that you have to tell your doctor what you want, and what is available other than the monoclonal antibody?
Okay, so there were a couple questions in there. I don't think you have to tell your doctor what you want. There's clear science about what works and what doesn't in the inpatient treatment of COVID-19. Typically, I mean, by definition, pretty much anybody that comes in is on oxygen. So oxygen is one of the main components of therapy as people come in. If you are hospitalized, monoclonal antibody is not a treatment option for you. It's under emergency use authorization and is not indicated for inpatients. So really, remdesivir, oxygen, and steroids are still the treatment of choice. I know that there's a lot of, I won't call it news because it's probably not. There's some information out there where people will tell you things like, you know, megadoses of vitamins. We still hear about hydroxychloroquine. We still hear about other medications that people claim are helpful in the treatment of COVID-19 on an inpatient. We are following the science, and when we see science that shows those drugs are effective or those other medications are effective, we will start using them. But until we see the science that backs that up, we are not doing those more controversial and suggested treatments.
Thanks, Dr. Nefce. Now I'm going to switch gears over to Wendy. We have a reporter asking a couple of questions related to some of the data that you shared. So the first is, what is the percent deaths have increased over the past month due to the surge compared to the past week? I know you had total cases and total deaths by month. Do you know those percentage increases?
No, I would have to, I'd have to calculate those.
Okay, so maybe we can calculate those and get back to the reporter that way. And the reporter is also noticing that why is there any reason why most people who have died from COVID-19 are male?
You know, I would probably be speculating, which I really don't want to do. You know, could be a few reasons. It could be, you know, in general, men are a little more reluctant to go get care. So that could be a component of it. But also, unless I were to go back through and look at, you know, all the different death certificates or notes, find out if they had underlying conditions. You know, typically it's an underlying condition that is going to put you at higher risk, and then being unvaccinated. So it's going to be some combination of that. But you know, we'd have to go through individually.
Okay, great. Thanks, Wendy. Dr. Nefce, is a positive result from a home testing kit considered medically confirmatory to qualify a person for treatment with monoclonal antibody therapy or insurance coverage treatment of long COVID if patients develop that in the future? And how should a person report that positive result? So let's start, I'll ask Wendy to comment on the reporting, but what is a home test kit medically confirmatory?
I would say in general, yes. I mean, we have certainly heard throughout this pandemic about, maybe less scrupulous people putting products out there. I think that that's been largely controlled. So most of the things readily available for you to purchase, like at a pharmacy or whatever, are considered, enough. That being said, it's important that you report it. And so Wendy had talked about on the Grand Traverse website, and our other health departments likely have the same thing, as does the state. There are ways, and some test kits that you get over the counter actually require you to have like a virtual visit, in which case those test results would be tracked and sent forward. So if you just took one and never reported it, you're going to have a much harder time linking that from an insurance perspective or anything like that. So that's really important for two reasons. One, for you personally, so that people can know what your health status is and, reimburse you or ensure that things are taken care of long term, but also for us from an epidemiologic perspective, understanding the positivity rate out there. So if you do take a home test, we would highly encourage you either through the test mechanism, depending on which you got, or through your local health department to report a positive result.
Thanks, Dr. Nefce. And Wendy, just give you an opportunity to reiterate what people in Grand Traverse County should do if they do have a positive home test result.
Yeah, we do have an option for reporting that test on our website. We do want the positives. We don't need all the negatives. I would also say that if you are someone who's been exposed to someone and you have symptoms and you take a home test and perhaps it's negative, it probably would be a good idea to get confirmation of that through a PCR test, just to confirm that you're not actually exposing to someone in your household or others. And then again, the numbers are good for us for surveillance. It's how we, are monitoring the surging cases and things like that.
Thanks, Wendy. Dr. Nefce, I'll go back to you. You had mentioned earlier about the cases of flu in the region, and that flu is also a vaccine preventable disease. This person is asking, but people are saying the flu vaccine is not a good match this year. Could you please comment on that?
Yeah, there is some preliminary data that show that the match isn't as good as it's been in some years, although we do know that even a relatively poor match with the flu vaccine does still help you fight off infection and prevent more serious illness and hospitalization. But just like anything, when you see high rates of a disease spreading through your community, the vaccine piece is important, but so is masking and other mitigation factors. So staying home when you're sick, getting tested, wearing a mask if you're outside, washing your hands, not touching your face, all of those things really are in combination what helps us prevent the spread of disease. It's just like, when you're driving your car, you have a seatbelt and airbags, and you stop at the stop signs and you obey the speed limit. It's really a combination of things working together that best protect you and best protect the community.
I like that analogy, thanks. Dr. Nefce, this next question is also for you. If you have gotten COVID-19, how much time should you wait after having the virus to get a booster? I have heard 2 weeks, 30 days, and 90 days. Which is the safest?
So the most recent data that we have says that as soon as you are no longer contagious, so you've gone through, either your 10 days, maybe now 5 days, you no longer have symptoms, that it's safe for you to get that vaccine. I think the only caveat I would put on there is if you have symptoms of long haulers, I would go have a conversation with your primary care provider or physician about when you should go get it. But very initially, early on in the pandemic with the vaccines, they were saying wait 90 days. They very quickly turned around and said there's no need to wait 90 days between whether you have it, had COVID, and get your vaccine. There is a 90-day wait time with monoclonal antibody and getting the vaccine, just because the cross-reactivity there. But for having COVID, it's safe once you are no longer contagious to go get vaccinated.
Great, thank you for that information. The next question is also for you, Dr. Nefce. Question is, how long do the antibodies last once people have had COVID-19? Do we know?
We don't, and that's a great question, and it really depends. So, a lot of this is your body's personal response to getting the vaccine, and recall, many diseases we start in childhood where you have a much more robust immune system than you do when you're older. And even with them, we require multiple doses of lots of vaccines before we have a full long-term immunity. So, we are very much learning as we go with this particular one. It looks like after 6 months, immunity starts to wane for most people. But certainly we know people who are immunocompromised, for instance, people who are older have a less robust immune response. And so their immunity may wane sooner than others. So it really kind of depends. We're not sure. We think this is why we're recommending a booster now, that at about 6 months after that second dose of the mRNA vaccines and 2 months after the J&J, that your immunity starts to wane, and a booster will help further bump up your immune response against COVID-19.
Thanks, Dr. Nefce. And I think as we do get more information and if data is available, we'll definitely report it out at future press conferences. The next question is, and I think, tell me if I'm wrong, I'll direct it to Wendy first, but if this was Dr. Nefce's slide, just let me know. There was a slide where someone mentioned that 2% of vaccinated individuals are estimated to have gotten breakthrough infections. Is that local, state, US data, or just those hospitalized at Munson Healthcare?
That's actually statewide data.
Okay, thank you for that clarification.
Statewide data, yes.
Statewide data, okay, great. This is an interesting question, Wendy. Will there be any free mask distributions in the area?
I'm not aware of any right now, but I certainly hope so. So we will be contacting, I was taking notes on that question. We'll certainly be contacting our state partners to see if they'll be doing mass distribution. Certainly with Omicron being, more of a respiratory than droplet, and with the advisory from both CDC and the state for everybody to wear masks indoors, I hope that masks will be coming soon.
Great, and we are getting a couple of questions about the new CDC guidelines for quarantine. And I know Wendy addressed it, but I'd like Dr. Nefce to also comment on this. So could you just explain how the CDC's recommendations may differ from OSHA, and a little bit of the complexity that creates, and how we're going to navigate that with not only the general public, but people who own businesses, and especially healthcare workers. So maybe Dr. Nefce, could you just comment on that first?
I will do my best, but welcome to the complexity that is healthcare and public health. So, just as a reminder, OSHA has rules that we have to adhere to from a workplace perspective. The CDC is more issuing guidance broadly for public health. So I think what the CDC is trying to do with these changes is really acknowledge, how I guess the surges that we've seen in healthcare, the issues that we're seeing with staffing and those kinds of things, and saying, look, if you need some flexibility to get people that you know are relatively low risk, they're vaccinated, you're wearing full PPE, all of that kind of stuff, and you need to get them back at working, we'll give you that flexibility. That being said, we have to adhere to what the OSHA rules are. So until either the federal OSHA or my OSHA issues something more specific, we're going to be following those OSHA rules from a healthcare perspective. The CDC guidance for more broadly from a community perspective, you know, in schools or those kinds of things, I think is where a little bit more of that flexibility lays. So I'll send that over to Wendy to comment, since that's her area of expertise.
I don't think I have much to add on that, other than, yeah, usually once CDC does make a recommendation, then we expect we will see some changes from OSHA and likely MyOSHA. And we still have yet to see what the state health department has to say about the new quarantine guidance as well.
Thank you both. I know that's hot off the presses. So as we sort through that more and understand what other changes may be coming, we will definitely let everyone know. And just as a point, when Dr. Nefce was speaking about the different oral medications that may be available for COVID-19, we do hope to have Dr. Nick Chorney back with us either next week or in a future to talk about those different pharmaceuticals and get into a little bit more detail on those. So look forward to that. We are unfortunately out of time today. I know we didn't get through all of the questions, but we will try to follow up with some of the reporters on some of the more specific questions, especially some of the percentage rates. Wendy will get back to that reporter on that. But I would like to just thank Dr. Nefce and Wendy for their time today. And just a couple follow-up slides that I just want to get to. As always, I'd like to give a summary of the community resources out there. Please go to munsonhealthcare.org. You can find a list of all these resources. But again, the 211 Michigan line is always a great resource, as well as the Area Agency on Aging of Northwest Michigan, in addition to all of the health department resources. Next slide, please. And as always, I encourage you to sign up for our e-newsletter, follow us on social media, visit us at munsonhealthcare.org. And if you have specific COVID-19 questions related to the vaccine, related to boosters, related to any other health questions you may have, please call 231-935-0951. So again, Dr. Nefce, Wendy, thank you again for your time. We will have another one of these press conferences next week. And until then, I hope everyone has a very safe and healthy new year. Thanks, everyone.
Thanks, Diane.